Ajay sir, your skin is ulta. It's in landscape. Ajay sir, rotate your screen.
Trying, sir. 1 second.
Yeah. No. Meeting.
Okay, sir. Let me start.
Yeah.
Good afternoon, everyone. A very warm welcome to all of you joining us today for another insightful session from Onus Robotic Hospitals, Hyderabad. Today's topic addresses one of the most crucial yet often overlooked threats to heart health: cardiac consequences of smoking. Facts every smoker should know. We all know smoking is harmful, but many don't realize just how deeply it affects the heart, from damaging blood vessels to increasing the risk of heart attacks and strokes. This session aims to shed light on those hidden dangers and empower everyone with knowledge that can truly save lives. We are honored to have with us Dr. Vinod Vartya, a leading interventional cardiologist at Onus Robotic Hospitals, who has dedicated his career to preventing and treating cardiovascular diseases. With his vast experience and compassionate approach, Dr. Vinod will help us understand the science behind how smoking impacts the heart, and more importantly, what can be done to reverse the risks. So before we begin, a quick reminder, you can post your questions anytime in the QA box. We'll address them towards the end of the session. So without further ado, let's get started. So please join me in welcoming Dr. Vinod Vartya to take us through this enlightening talk on cardiac consequences of smoking. Please go ahead, doctor.
Good afternoon, everyone. Thank you, Ajay sir, for your warm welcoming note for this session. So today we are going to discuss one of the most dangerous in our this era, where our young patients are affected by heart attacks, which is reversible. We can prevent heart attacks which, with preventing smoking, with stopping, quit smoking. So I need to highlight few features, few insights regarding this smoking, how it affects our hearts. So yeah, we're going to slides. So smoking, which hurts our heart, long-term smoking, which leads to a lot of consequences. So here, yeah. Today, my topic on smoking and heart diseases. So there is outline of this introduction. I'm going to give facts and figures on India and world health and smoking. What are the types of heart diseases related and smoking and heart congenital heart diseases, by birth diseases, and smoking and atherosclerosis, coronary artery disease, and what are the policies to be made and what are the interventions to be made by Indian government to stop this smoking. And finally, conclusion and post references I'm going to present. So here, coming to introduction, smoking is the act of inhaling and exhaling the fumes of burning plant material. So, what are the types of cigarettes? What are the types of smoking? We can say cigarettes, shisha, cannabis. There are a lot of nowadays. We can say ganja, cocaine, marijuana, uh, all weed we can see nowadays. So, what are the predisposing factors to smoke? So, basically, low income countries and poor housing and unemployment societies will develop this type of nicotine exposure during childhood. So during childhood, nobody warned them. Their parental brought up might be changing their thoughts and financial pressures and stress, anxiety and depressions. Nowadays, we have seen a lot of young IT peoples are under anxiety and depressions. Those who are deliberately going for this type of smoking. So parental and peer examples are we can say. So what are the major facts in India? So in India, smoking and tobacco use is a major risk factor, which leads to cardiovascular diseases. So tobacco is smoking, whether smokeless, both can cause approximately 1 million adult deaths per year in India, accounting for 9 to 9.5% of all over deaths. So according to WHO, tobacco use in India leads to 1.35 million, which leads to annual deaths. So among adults more than 15 years in India, about 15% are smoker, and which is a common risk factor estimates. Among Indian patients, the coastal region study shows that AMIs are acute myocardial infarctions are 61% of cases were current smokers and 16% were controllers. So here major we can say among Indians 61% we can say. So the year standard CVD deaths in India was about 272 per 1 lakh population. So in recent study analysis shows that mortality from ischemic heart disease attributed to smoking showed a decline trend with estimated annual percentage of change. So Indians often develop heart diseases 5 to 10 years earlier than many other populations in the world. So 1 million deaths per year in India due to tobacco use. 15% Indians are tobacco smokers. Smoking found in 60% of AMI patients. Indian developed heart disease 5 to 10 years earlier. Year standards are 272 per 1 lakh people. Smoking attributed to ISD mortality shows modest decline, but burden remains high. So what are the effects? Not only the heart, there are a lot of overall or body affected by the smoking. So first we can see the top to bottom. So which raises overall cancer risk almost everywhere in the body and which leads to mental health problems and eye vision changes or eye loss, increased risk of heart attack, heart diseases, increased gum disease risk like cancers we can see, increase brain strokes, heart strokes, and psoriasis risk, increase diabetes type 2, increase osteoporosis risk, and fertility problems, delayed wound healing, irreversible lung damage, increased risk of Chronic lung disease, which leads to COPD, which leads to car pulmonary, heart and lung both are affected by this type of diseases. So coming to our topic, smoking, what are the types of heart diseases? So smoking is a major cause of cardiovascular deaths, accounting approximately 1 in 4 deaths from CVDs. CVDs are like atherosclerosis, coronary artery disease, peripheral artery disease, abdominal aortic aneurysm, and stroke. Same thing I have mentioned here. So what are the chemicals in the tobacco? Nicotine, which is a major one, which increases our heart rate, which increases our sympathetic tone and increases heart rate and blood pressure. Carbon monoxide, which reduces the oxygen to the tissues, and tar and oxidants, which damages the vessels lining, and free radicals, which promotes the inflammation, which leads to plaque formation, which leads to heart attacks. So here, how does smoking affect our heart directly? So destroy the blood vessels and increases blood pressure, reduces oxygen supplies to the tissues, and irregular heart rhythms, arrhythmias, and inflammation. Oxidative stress leads to a lot of anxieties, stress. So smoking and congenital heart disease. Mothers who smoke early in pregnancy also leads to give birth to infants with heart defects, which are the most common. We can say pulmonary valve anomalies and pulmonary artery anomalies, atrial septal defects. Here in layman language, you can say hole in the heart, atrial septal defect, and maternal smoking may account for 1.4% of all CSDs. So smoking and atherosclerosis. Here, smoking is an independent risk factor for this, which leads to chronic low-grade inflammation of the vascular systems, atherosclerotic plaque formations. Nicotine increases as I discussed as blood pressure increases, heart rate increases, polycystic aromatic hydrocarbons, which leads to atherogenosis and increased artery thickness in smoking adults and aggravates the global burden of the disease. So what is the mechanism behind this? So tobacco, which leads to endothelial dysfunction, macrophage recruitment and activation, vasomotor, smooth muscle relaxations, phenotonic modulation should be there, adipocyte dysfunction, which leads to inflammation in the arterial wall, leads to leukocytes, interleukins, chemokines, TNFs will be released, which leads to necrotic core formation in the normal artery, leads to atherosclerotic plaque formation. Over the period, it develops to atherosclerotic plaque rupture and leads to heart attacks. So smoking and coronary artery disease, less than 5 cigarettes per day also increases the risk of chances of heart diseases. So CAD mortality increases with the number of cigarettes smoked per day. Relative risk of CAD decreases with the increasing age of onset of smoking. Most of the people says that early onset of early smoking which leads to major damage. Here, relative risk of CAD decreases with the increasing age, like last like 50, after 50 you started smoking, it will lead to little bit, we can say, when compared to younger age group. So cigarette smoking has been associated with higher relative risk of heart attacks, myocardial infarctions. So that due to MI and CAD is less common in those who smoking compared to who still smoking. So those who are stopped smoking, they are in better positions. So here I've discussed same thing, 2 to 4 times more likely to develop CAD. Risk increases the number of cigarettes smoked per day. Even occasional or passive smokers can have the risk of heart diseases. So passive smoker, active damage. So non-smokers exposed to smoke have 25 to 30% of higher risk of heart diseases. We can say most of the people around with the friends with those who are smoking, so they say that we don't have any problem with smoking, but they will affected by this passive smoking. Children of smokers suffer respiratory and cardiac developmental effects. So what are the benefits of quitting smoking? So here we can say this is the best slide to show that after quitting your smoking, 20 minutes of stopping of smoking, somehow your blood pressure will be decreased, heart rate will be dropped. When you are smoking, their sympathetic innervation increases, autonomic nervous system will increases, which leads to higher BP, higher heart rates. After 24 hours of quitting smoking, carbon monoxide levels will be normalized in the body. And after 2 to 12 weeks, you can say circulation improves in our body. And after 1 year of stopping of smoking, heart disease risk almost 50%. And more than 15 years of stopping of smoking risk equal to non-smokers. So this is regarding smoking. So here I'm going to discuss, this is the main topic to discuss here, even in a younger patients, we have seen earlier days that more than 50 years patients will have heart attacks and according to our criteria. Nowadays, 26 years of old smoker with heart attack here you can see. So there are no comorbidities, no family history of any heart diseases. He presented with our hospital, retrosternal chest discomfort, breathlessness since about 10 hours. ECG shows some elevations in the V22, V6, 1 AVL, 2D echo wise, there is a RWMA positive and heart pumping. EF is 45%. So we have immediately taken him for primary CAG. So here, primary CAG, you can see this is the left coronary arteries we have shown here. Here you can see at the bend, you can see there is a narrowing portion here you can see. So this is the blood clot where stopping the flow. So immediately we have taken primary, we have put the wire, and here you can see this part, this is the thrombotic plaque. So here blood clot occluded here and it decreased the blood supply. So we have put the wire. This is the stent across the lesion. So this is stent, how we are doing. After stenting, you can say here, this stent you can see. So normal blood vessels. So whatever the blood clot or plaques or fat inside the artery, it embedded outside and we put the stent and blood flow is normalized. So here you can say those patients presented with heart attacks early stage, immediately within 10 to 12 hours. Young patients recovery will be very faster, but presentations depends on presentation. If some patients immediately within fraction of seconds they can collapse because of arrhythmias, VT, VF, cardiac arrest can occur after heart attacks. So we have not saved those patients, those have cardiac arrest at home or in places of public places we can see. So what are the management of smoking related to cardiovascular disease? So patient presented with heart attacks, acute management like PCA and CABG are the options. Before that, we can evaluate like ECG, basic and foremost, then go for 2D echo test, troponin test, and other tests are like non-invasive tests are there, stress echo is there, and CT coronary angiogram nowadays is the most common in young patients to assess their risk of heart diseases. So remaining medical therapy and rehabilitations are very important. Here you can see smoking is a risk factor for heart disease. Benefits of smoking starts immediately, blood pressure normal or low rise, and in weeks easier heart to pump blood. And in a year, risk of heart attacks falls almost 50%. 5 to 15 years, risk of heart attack falls to that non-smokers. So talk to your doctor, nurse, or pharmacist about options to help to quit smoking. Becoming smoke-free is the best thing you can do for your heart. So call for help to quit smoking. Support programs are there, and there are a lot of other things how to alternate to smoke, like there are the nicotine gels or nicotine patches, lozenges, they are available in the market. So here there are a lot of smoking session centers in India available. So what are the motivations? What are the things here? The triangle shows that some motivation and behavioral counseling and medications we need to use. Motivation, education, educating the patients regarding the highlighting the harmful effects of the tobacco and the benefits of quitting it. Encourage the quitting by providing easy methods of handling withdrawals. So providing handouts containing information regarding the dependence and cessation of the smoking. So behavioral counseling recognize and come up with the coping measures and for triggers for tobacco use and prevent relapses. Medication use of nicotine replacement therapies are there. Pharmacological agents like buprenorphine and penicillins, lozenges are available in the market. So here is one initiative taken by WHO, which is called as Empower. Here in Empower says the monitoring use of tobaccos, where we are uh, abundantly using tobaccos in which areas, what are the areas to control. So P for protection of the people from tobacco smoke and offer them aid to quit use of tobacco and warning regarding the dangers of tobacco. E-cause enforcing bans on advertising, sponsorships, and promotion of tobacco products, and raise the taxes on tobacco products where patients not affordable for that, and they can slowly withdraw from the smoking or tobacco uses. So conclusion says that smoking is associated with major heart disease as atherosclerosis. Smoking is addictive and prevalent among low-income earners. Smoking during pregnancy lead to congenital heart disease. Smoking is highly discouraged and has been banned in public places as a means to curb the habit. So thank you. If any questions, welcome.
Thank you so much, Dr. Vinod, for that eye-opening session on how smoking affects the heart. The insights you shared were truly valuable and thought-provoking. Now we'll move on to the Q&A session. We've received some interesting questions from our participants. Here's a question from our attendees. How soon after quitting smoking does the heart start to heal?
Almost time, it will take time, like immediately it won't, it will take almost years together to normalize your heart. But whether at what age you have started smoking, that's a very important age of onset. Suppose at the age of 15 or 20 years you started, and you have been smoking for long years, like 20 years you have been smoke, then the effects will be major effects, like your lungs will be damaged, your heart will be damaged in other ways, peripheral vascular diseases, peripheral arterial diseases, brain strokes, this will happen. So normalization will be this, whatever we have discussed, BP and heart rate, and you discuss few things will be normalized over the period of weeks to months, but long term effects will be there.
Thank you, doctor. Another question here is that are there any early warning signs of heart damage that smokers should watch for?
Yeah, definitely. Smokers, they have the warning signs as other patients. Non-smokers and smokers, there won't be different warning signs. Same warning signs will be there, like normally left-sided chest pain, jaw pain, radiating left hand pain, shoulder pain, and profuse sweating, unusual tiredness, chest discomfort, and breathing difficulties. Most of the patients with smoking, they present with smoke, coughing. They were used to cough regularly. Non-productive cough will be there. So these patients, we need to take care of their lungs. Most probably, their lungs are affected. So we need to see for warning signs, like over the period. Suppose before affected by heart attack, they will have some breathing difficulties initial days, and normally patients will tell that earlier used to walk 4 kilometers a day easily without any strain or stress, without any breathing difficulty. Nowadays, I'm getting some sort of breathing difficulty. When I used to walk 1 kilometers, I used to get fatigue or I used to get breathless. So these are the symptoms, we need to notice them, like your capacity, your working capacity and vital capacity is decreasing, and these are the warning signs we need to take.
That's some valuable tips, doctor. Thanks a lot for that. Um, Another very interesting question is vaping or e-cigarette safer for the heart compared to traditional smoking?
No, there is no way that these are the alternative, we can say, but there is also damage to the heart, damage to the lungs. So there is no way that we can say this is safer. There is no safe regards with e-cigarettes.
Thanks, doctor. That's a myth which is being broken today. So the final question before we let you go, how can family members support a loved one who's trying to quit smoking for heart health? Because even secondhand smoke is also injurious to health, and they can also lead to heart problems, right?
Yeah. I've seen a lot of, like my school friends, I can say, those who have smoked, they had heart attack over the period. They had brain strokes. I've seen. So their family is very much struggling to quit smoking. So things that uh, we need to monitor the patients very gentle manner, like they will stop aggressively and they will develop withdrawal symptoms immediately. So in those patients we need to cut down the cigarettes, like when you're cigarette taking cigarettes for 15 per day, then you can cut down to 10 in the one day, then you can cut down slowly, slowly, one by one cigarette you need to cut down. Over the period, slowly our body will habituate to that, whatever the uh, number of cigarettes. Like after the period, you can go for 3 cigarettes and slowly withdrawal symptom will be vanished. But sudden stopping smoking is very dangerous. Better to continue those patients uh, instead of sudden stopping. So there will be lot of centers, rehabilitation centers, smoking stopping centers are there. So there are the criteria, there are the helping hands to quit smoking. So we need to approach further.
Thank you, Dr. Vinod, for taking the time to answer all those questions with such clarity. And thank you to everyone who participated. Your curiosity and engagement make these sessions so impactful. So, as we conclude today's webinar, we hope this session has given you a clearer understanding of how smoking silently harms the heart and how crucial it is to take steps towards quitting. A heartfelt thank you once again to Dr. Vinod Vartya, interventional cardiologist at Onus Robotic Hospitals, Hyderabad, for sharing his expertise and guiding us through this vital discussion. To all our participants, we truly value your presence and feedback. So please take a moment to fill out the post-webinar survey that will appear on your screen right after this session. You can alternatively fill out your survey from the email as well. The link would be on your email. Your feedback helps us bring you more meaningful and informative health webinars. So stay tuned for upcoming webinars from Onus Robotic Hospitals on various health and wellness topics. Until next time, stay happy, stay healthy, take care of your heart, and stay happy. Thank you. Good day.